First of all, I'd like to have on stage Ms. Shonda Elsteimer, Director of Health and Family Planning, USAID. Please welcome Ms. Shonda Elsteimer.
Thank you very much, respected Secretary of Health, Dr. Pravin Mishra, Dr. Mancuso, President and CEO of JPIGO, and let's see, Dr. Regmi, and I think Dr. Burma has left as well, or unfortunately has left, but all the ministry colleagues that are here today, distinguished professionals and guests. It's really my pleasure and honor to participate in JPIGO's 40th anniversary celebration. And as highlighted by Dr. Mancuso, this is a global celebration for JPIGO, an organization that has really been a strong partner of USAID's, both globally in the world and here in Nepal. And I'll keep this short because I know that there's a lot of information that's already been shared, and I really appreciated Dr. Regmi's presentation. I think it's really useful to look at where we've been and where we're coming from. I think it keeps the perspective there for all of the work that we're doing. I personally have worked with JPIGO in many different countries, starting with Zambia, and then Uganda, and now Nepal. And there are many contributions in the field of health that are really truly remarkable. Among the many activities and programs that JPIGO has worked on and continues to work on globally, I would highlight and agree with what has been presented here today, that their greatest impact and expertise has really been in piloting and testing low-cost, innovative techniques and approaches in service delivery that are really continually being adopted and used by ministries of health around the world. Here in Nepal, I think the story is the same. While I myself have only been in Nepal for a little less than 3 years, I've worked closely with those who have been involved with JPIGO for decades and who have consistently highlighted JPIGO's key contributions throughout their time here in Nepal. And I think I was truly struck with how extensive their support has been to, one of the things is improving, obviously, the national training capacity in the country, especially in the area of maternal health. They've really been the driver of improving the many training approaches that we are using today at NHTC, and they have really worked to make those trainings approaches more integrated, efficient, and standardized, and as well as more cost-effective for the Ministry of Health. They've also exposed, as we saw in Nepal, to many new devices and service delivery approaches, and then linked those to the field and the community. I think this has included, as we said, post-abortion care services, infection prevention, kangaroo mother care, and most recently, community-based interventions for postpartum hemorrhage and eclampsia. And then finally, one of the things I also think they've done is they've really consistently understood the value of bringing the skills and knowledge of academic institutions and into developing the training curriculum and packages, the quality improvement tools, the devices, the policy and guidelines. And they've done this across the country. They bring in academic institutions locally and also obviously from Johns Hopkins and other resources. And I think that's something that they do very well, and it's really helped to make their work very strong and evidence-based. So these are, of course, just a few of the recurring themes that have stuck in my mind as I've grown to understand JPIGO's history and legacy here in Nepal. Today, JPIGO is a USAID partner with both our integrated nutrition program, Suahara, and with our health governance and quality of care program, Health for Life. Under both of these programs, they are building on their long and distinguished work to further improve the clinical skills of health workers and the performance of health facilities throughout the country. And on behalf of USAID, I would really like to thank JPIGO for their commitment and dedication to improving the quality of family planning, maternal, newborn, and child health services in the communities in Nepal and around the world. So their work in Nepal is truly, I think, a testament to all of the work that they do globally. So thank you very much.